Hello students, today we will have lecture on immunity. What are the points? Definition, types, it is innate or acquired, and then different types like adaptive, local and herd immunity. So first we will see definition. So it is defined as resistance offered by host against microorganisms or any foreign substances. Then what are the types? So it is divided into two types mainly, innate and acquired. So innate immunity or native immunity, it is the resistance by virtue of genetic and constitutional makeup. So it is present since birth. And then again it is divided into two types, the non-specific and specific. And acquired immunity, it is also called as adaptive immunity. So it is a resistance acquired during the lifetime. It is different from the inborn. And then it is again divided into two types, that is active and passive immunity. Then we will see difference between innate and acquired immunity. So innate immunity, it is present since birth, microbial exposure not required, it acts immediately, no memory present, and mechanism can be barriers like anatomical barrier, physiological barriers, or secretory products in the body and normal resident flora which protect from the pathogenic organisms. And it is divided into two types, specific and non-specific immunity. Then acquired immunity, it is acquired during course of life, microbial exposure is required, it does not act immediately, it takes some time to act to form the antibodies, and then memory is present for the second or subsequent infection, and mechanism is of by T cells or B cells, and it is divided into two types mainly, active and passive, and each is divided into natural and artificial. So now what are the components of innate immunity? This we will see in detail. So anatomical barriers, physiological barriers, then resident flora, phagocytes, natural killer cells and complements present in blood. And the components of the acquired immunity, they are T cells, B cells and complements. So now this we already saw, types of immunity. Innate immunity is non-specific, and then it is divided into species, racial and individual. And again specific immunity, it is divided into species, racial and individual. Now we will see factors responsible for the innate immunity. So it is age, extremes of ages. So extremes of ages, they have low immunity. Then hormonal influence. So endocrine disorders like diabetes mellitus, hypothyroidism, they increase susceptibility to infection. So that means low immunity. Then nutritional status. So malnutrition, this cell-mediated immunity, and hormonal, humoral immunity, that is antibody-mediated immunity is low in malnutrition. The mechanism of immunity, innate immunity, so this is first line defense. So examples are, first is anatomical barrier. So skin, mucosa. So skin, intact skin and mucosa prevent entry of microorganisms. The sebum present in skin, it is antimicrobial. Then mucosa prevent entry of microorganisms. Mucus, cilia, they are present in that mucosa, propel microbes outside. Example, cilia in respiratory tract. Then coughing, sneezing and urine flush, these all mechanisms, they remove bacteria. Then secretory products, they inhibit growth of microorganisms. So few examples are there. So in saliva it is lysozyme, in tears it is lysozyme, in gastric juice it is HCl, trypsin and protein digesting enzymes are present in intestinal juice. Then bile salts, they rupture the bacterial cell membrane and then thus cause the killing of the microorganisms. Then lactoferrin bind to the iron and inhibit bacteria. Spermine inhibit bacteria in semen. Sebum contains chemical toxin to kill the bacteria. Then physiological barrier, so temperature which inhibit growth of the bacteria. Low pH, that is gastric acidity, inhibit growth of bacteria. So here you can see examples of non-specific defenses. So mucous membrane are physical barriers to microbes. Lysozymes present in tear and saliva. Then mucus coated hairs in the nose trap inhaled particles. Mucosa of the upper respiratory tract is ciliated, and that cilia in trachea help moving out the bacteria away from the lower respiratory passage. Flushing mechanisms like coughing, sneezing, lacrimation, salivation, peristalsis, urination, so they all help to flush out the microorganisms. Then gastric, so that hydrochloric acid neutralizes Helicobacter pylori neutralizes acidic patient. That is why Helicobacter H. pylori grow in stomach. So blood complements iron binding proteins like lactoferrin, transferrin. So they all inhibit growth of microorganisms. Lysozyme enzyme that degrades peptidoglycans. So gram positive bacteria are more susceptible than gram negative bacteria. Then phagocytes like macrophages are chief phagocytic cells. Free macrophages wander throughout a region in search of cellular debris. Then Kupffer cells present in liver and microglia present in brain are fixed macrophages. Neutrophils phagocytic when encountering infectious material. Eosinophils are weakly phagocytic against parasitic worms. Mast cells bind and ingest a wide range of bacteria. So these all types of phagocytes, they inhibit or kill microbes. Then now we will see acquired immunity. So acquired immunity is divided into naturally acquired and artificially acquired. And naturally acquired is again divided into active and passive. So we'll see example of active and passive. So active antigens enter the body naturally. Body produces antibodies and specialized lymphocytes. In passive, antibodies pass from mother to fetus via placenta or to infant in mother's milk. Artificially acquired active antigens are introduced in vaccines. Body produces antibodies and specialized lymphocytes. In passive, preformed antibodies in immune system, in immune serum introduced into body by injection. So now we will see comparison of active and passive immunity. So active is produced actively by host immune system. So host participation is required in active immunity induced by immunogen or infection. It is durable and effective protection is there, and immunity effective only after a lag period. So some period is required to build up the immunity, that is production of antibodies. So that is called lag period. In passive immunity, it is received passively, so host participation is not required. Then it is in ready-made or form, it is transferred. It is transient and less effective, and immediate immunity, in that lag period is not there because it is a ready-made form. So in active immunity, immunological memory present, booster effect on subsequent dose is present. The negative phase may occur because of the previous antibodies and then not applicable in the immunodeficient persons. In passive immunity, there is no memory, subsequent dose less effective, but no negative phase and applicable in the immunodeficient people. Then mechanism of immunity. So in acquired or adaptive, there is third line of defense. Then we'll see types of acquired immunity. So that we already saw. Acquired immunity is resistance acquired during the lifetime. It is of two types, active, and then active is again of two types, natural and artificial. So example of natural immunity is following natural microbial infection, and artificial is because of the vaccines. And then passive, it is again divided into natural and artificial. So natural example is immunity transferred from mother to fetus, and artificial through the immunoglobulins or ready-made antiserans. Then naturally acquired, it is clinical or subclinical infections. We already saw response to a bacterial or viral infection. Example, chickenpox, smallpox. Artificial acquired active immunity, response to a vaccine of dead or attenuated pathogens. Immunity is provided by the vaccination. Now we'll see few vaccines. So vaccines are preparations of live or killed microorganisms or their products. So there are bacterial or viral vaccines. So and there are different types. So live vaccine, example of bacterial is BCG and viral OPV. Killed vaccine, example in bacterial is cholera, and in viral it is Salk, that is for the polio. Then subunit vaccine, it is typhi VI in bacterial, and viral hepatitis B. Then toxoid, it can be tetanus in bacterial. So we'll see a few differences between live and killed vaccines. So live vaccine advantages: single dose is sufficient, induces local and cell mediated immunity. It is more effective and long lasting, cheaper and used for mass immunization. Advantages of killed vaccine: stable and safe to administer, can be given in combination with polyvalent vaccine, no danger of spread of vaccine oriented infection. Then disadvantages of live vaccine: the reversion of virulence possible, can spread from vaccines to contacts, pre-existing viruses can interfere, cold chain has to be maintained, few cause local and remote complications. Disadvantages of killed vaccine: multiple injection, that is booster dose is required, and local immunity and cell mediated immunity is not induced. Passive immunity. So, passive immunity: when ready made antibodies are transferred to a recipient, the recipient's immune system plays no part. It is called passive. It is only transfer of the antibodies or immunoglobulins. Then it is of two types: natural and artificial. So, in naturally acquired from mother to fetus via placenta, or the examples are breast milk, so it contains IgA and monocytes; colostrum, it contains bifidus factors, antibodies that protect newborn from the gastrointestinal infections. Then IgG, a type of antibody that is transplacental and protects infant up to 3 months. Then artificially acquired, from the injection of serum such as gamma globulin. The method of collecting an IgG from an infected immune person and transferring this immunity to an unprotected person, sometimes given to infants who are not producing enough antibodies. Example: ATS and ADS, that is anti-tetanus serum or anti-diphtheric serum. Next type of immunity is adoptive immunity. A special type of immunization is the injection of immunologically competent lymphocytes. This is known as adoptive immunity and does not have general application. Instead of whole lymphocyte, an extract of immunologically competent lymphocytes, it is called as transfer factor, can be used. This has been attempted in the treatment of certain types of diseases. Example: lepromatous leprosy. Then other types: local immunity, immune response at mucosal surface. Example: intestinal, respiratory or genitourinary mucosa, and it is of IgA antibody type. Herd immunity, it is overall immunity of community to pathogen. It prevents epidemic diseases. An example of herd immunity is following vaccination. So smallpox is eradicated because of the smallpox vaccination, because of the herd immunity. And then it can be example is DPT, MMR vaccines. Hello students, welcome to this session. Let's study structure of immune system and immune response. Immune system: cells present in spleen, liver, lymph nodes, thymus, bone marrow, and circulate through blood and lymphatic fluid is called as immune system. The lymphatic system, it consists of thymus, lymph vessels, lymphatic tissue, and lymphocytes. Thymus location: it is bilobed organ present in the root of the neck, above and in front of the heart. Structure: the thymus is enclosed in a capsule and divided internally by cross walls into many lobules, each full of lymphocytes, WBCs, associated with the antibody production. In relation to body size, thymus is largest organ at birth. It doubles in size by puberty, after which it gradually shrinks, its functional tissue being replaced by fatty tissue. Lymphocytes produced in thymus are T lymphocytes. Function: infancy, thymus controls development of lymphoid tissue and immune response to microbes and foreign proteins. In adult, the function is unclear. Phagocytic cells, a cell that able to engulf and digest bacteria, protozoa, cells and cell debris and other small particles is called as phagocytic cell. The types are blood macrophages, they are mononuclear lymphocytes T and B, and monocytes polymorphonuclear neutrophil, eosinophil, basophil. Tissue macrophages, histiocytes. So lung alveolar macrophages, liver Kupffer cells. Function of phagocytic cell is phagocytosis. Phagocytosis is the engulfment and digestion of bacteria and other foreign particles by phagocytic cell.
Mechanism: the cells move toward the foreign particle. Their abundant cytoplasm produces pseudopodia. Pseudopodia engulf foreign particles. Phagocytosed particle is held inside the vacuole. It's called phagolysosome. It fuses with the lysosome, forming phagolysosome. Lysosomal enzymes digest the particle, the remnants being removed from the cell. Importance: phagocytosis is effective defense against most microorganisms like bacilli of typhoid, tuberculosis, brucellosis. Neutrophils are actively phagocytic and form predominant cell type in acute inflammation. Eosinophilic leukocytes are found in large numbers of allergic inflammation, parasitic infection. Basophils contain basophilic granules, leucine, histamine, serotonin, and other hydrolytic enzymes help in digestion of the foreign particles. Let's study immune response. Immune response: the specific reactivity induced by in host by an antigenic stimulus known as immune response. The protection against invading microorganism. Reaction against any antigen. Consequences: beneficial, indifferent, injuries to the host. Highly coordinated reaction of the cells of immune system and their products. There are two types: humoral or antibody mediated immune response and cell mediated immune response. Humoral or antibody mediated immune response. So it occurs through 3-6 steps. First, activation of B cells following contact with the microbial antigen. B cells act as APC, antigen processing cells. Proliferation and differentiation of B cells into effector cells and memory cells. Third, effector function: secreted antibodies by plasma cells, which in turn counteract with the microbes in many ways, such as neutralization, opsonization, complement activation, etc. Activation of B cells. Antigens that activate B cells fall into two categories. Most antigens are thymus dependent antigens. They activate B cells indirectly via activation of T cells. The TD antigens are processed by APC, presented to T helper cells, following which the activated T helper cells cytokines produced, and that in turn activate B cells. Thymus independent TI antigens, example bacterial capsule, are not processed by APC. They can directly activate B cells without help of T cell induced cytokines. Second, proliferation and differentiation of B cells. The new B cells released from bone marrow go and house in the B cell areas of the peripheral lymph nodes. Example, cortex of the lymph node and marginal zone of spleen. The new B cells are organized to form primary lymphoid follicles. Effector function of AMI: promotes opsonization, transcytosis, mediates mucosal immunity. Transcytosis of IgA to gut lumen provides mucosal immunity by neutralizing the microbes at local mucosal sites. Activates complement mediated inflammation and cytolysis. Promotes ADCC. ADCC is principally cell mediated. Antibodies direct the cells to reach the target cells. ADCC is important to provide immunity against helminths, tumor cells, and virus infected cells, that is NK cells, IgG mediated. Humoral antibody mediated immunity. Primary defense against most extracellular bacterial pathogens, helps in defense against viruses that infect through the respiratory or GI tract, prevents recurrence of virus infection, participate in pathogenesis of immediate hypersensitivity and certain autoimmune diseases. Now, antibody production consists of 3 steps: efferent leaf, entry of antigen, its distribution and fate in tissue, contact with appropriate immunocompetent cells. Central function: processing of antigen, control of antibody production. Efferent leaf: secretion of antibody, distribution of antibody in tissues and body fluids, manifestation and effects. Cellular or cell-mediated immunity protects against fungi, viruses, and facultative intracellular bacterial pathogens. Participate in rejection, homografts, and graft versus host reaction. Provide immunological surveillance and immunity against cancer. Mediates pathogenesis of delayed hypersensitivity and certain autoimmune diseases. Cells taking part in immune response: antigen presenting cells, B cells, and T cells. Production of antibodies stages: first, antigen capture and processing by APC; second, antigen presentation; third, T helper cell activation; four, B cell stimulation and differentiation; five, antibody production by plasma cells. Factors influencing antibody production: genetic factors, age, nutritional status, route of administration of antigen and site of injection, size and number of doses, multiple antigens, adjuvants, immunosuppressive agents, effect of antibody. Phases of antibody production: lag phase, no antibody is detectable in circulation immediately after antigenic stimulus. Log phase, titer of antibodies rises steadily. Plateau or steady state, equilibrium of antibody synthesis and catabolism. Phase of decline, catabolism exceeds production and titer falls. Primary immune response, the immune response after the first contact with the antigen, usually 4 to 10 days lag period. Secondary immune response, second contact with the antigen, lag period usually 1 to 3 days. Primary immune response involving B cells, naive B cells. Secondary immune response, memory B cells. Primary peak response time 7 to 10 days, secondary 3 to 5 days. Peak antibody response, primary depends on antigen, secondary 100 to 1000 times more than primary. Isotype generated primary response, in early response IgM predominates, secondary IgG predominates. Antigens thymus dependent and independent, secondary only thymus dependent. Antibody affinity, primary lower, secondary it is higher. Immunization needed, primary a comparatively high dose adjuvant there, and secondary adjuvant not required. Primary immune response, initial contact with antigen, slow, sluggish, and short lived, long lag phase, low titers of antibody, does not persist for long, IgM predominant. Secondary response, response to subsequent exposure to same antigen, prompt, powerful, and prolonged, short and negligible lag phase, very high level of antibody, lasts for long period, and IgG predominant. Here you can see the difference between primary immune response and secondary response. Cell-mediated immune response refers to destruction of cells carrying intracellular microbes and other abnormal cells such as tumor cells by various specific and non-specific cells of immune system, of which the most important is the cytotoxic T cells. Role of CMI: provides immunity against microbes residing in the intracellular environment. For obligate intracellular organisms, CMI remains the only effective immune response. For facultative intracellular organisms, bacteria like Listeria, Salmonella, Yersinia, and fungi such as Histoplasma, Cryptococcus. Immunity against tumor cells and other damaged and altered cells. Mediate delayed hypersensitivity, type 4 hypersensitivity reaction. Plays key role in transplantation immunity and graft versus host reaction. Cytotoxic T lymphocytes, principal effector cells of CMI, involved in destruction of target cells such as virus-infected host cells and tumor cells. Naive T cells, TC cells, that is CTLs precursors, respond to viral or tumor peptide antigens which are processed by target host cells by cytosolic pathway and presented along with MSC class 1 molecules. Activated TC in turn secretes cytotoxic enzymes that lyse the target cells. Function of CTL, target cell lysis. The activated TC cells produce two types of lethal enzymes called porphyrins and granzymes. The porphyrins produce pores in the target cell membrane through which granzymes are released inside. The granzymes are serine proteases. They induce cell death by apoptosis through CAPS pathway. Second, natural killer cells, large granular lymphocytes that constitute 10 to 15% of the peripheral blood lymphocytes. NK cells are cytotoxic but antigen non-specific, part of innate immunity, act as first line of defense and do not require prior contact with the antigen. Act against virus-infected cells and tumor cells till the disease cells are activated and take over the function. Antibody-dependent cell-mediated cytotoxicity. ADCC is exhibited by NK cells secrete porphyrins and granzymes Macrophages produce lytic enzymes and tumor necrosis factor. Monocytes produce lytic enzymes and TNF. Neutrophils release lytic enzymes. Eosinophils releases lytic enzymes and porphyrins and immunity against ailments. Induction of cell-mediated immunity, infection with intracellular microbial agents, only T cell dependent antigens elicit CMI. The outcomes of activated T cells. First, helper T cells activate macrophages, enabling them to kill intracellular parasites. Cytotoxic T cells secrete cytokines and destroy target cells. The cytokines, first interleukins, so interleukin 1, 2, 3, 4, 5, 6, 7, 17. And then colony stimulating factors, GM-CSF, G-CSF, M-CSF. Tumor necrosis factors, tumor necrosis factor alpha beta. Interferons alpha beta gamma. Detection of CMI, mixed lymphocyte reaction, in vitro system for assessing T cell proliferation in cell mediated response. Cell mediated lymphocytes, lympholysis, in vitro assay for testing cytotoxic function of effector cells of CMI. Graft versus host reaction is in experimental animals, provides in vivo system for studying cell mediated cytotoxicity. Difference between humoral and cell mediated immunity. Humoral mediation by antibodies, cell mediated by cells. Cells involved, humoral B cells along with T helper cells directly bind to soluble antigen. CMI T cells, CD4 Th and CD8 PC cells, T cell mediated antigens can activate CMI. Mediators, humoral immunoglobulins IgG, M, E, A, and D. Cell-mediated cytokines, lymphokines, monokines, interleukins, and interferons. Role in complement, humoral plays role in, IgG plays role in classical pathway, CMI no role. Hypersensitivity, humoral type 1, 2, 3, CMI type 4. Immunological surveillance, humoral limited role in surveillance and tumor immunity, major role, CMI major role in immunological surveillance and tumor immunity. Transplant rejection, humoral minimal role, cell mediated major role in homograft rejection and graft versus host reaction.
Hope you find this session useful for your understanding and for your exams. Thank you.